So, good morning, everyone, and welcome to Women Who Rock with Success. This is your host, Miss Diane Winbush. This is our fourth segment today of our breast cancer awareness study, and then it's also is like an empowerment and encouragement for women as well. We have impact, and the women have impact. The doctors, the physicians have unpacked, deposited a lot of information. It's very, very important. Um, it was kind of a little somber or sober or what have you on the last one. Come to find out, there were some individuals that were struggling in some demographical areas and locations. They didn't even have the resources. They didn't have any of it. And I can name a few right now here in Tennessee where the Susan G. Komen Foundation is very, very concerned as to the area. And so that's what we're here for. We're wanted to make sure we can bring whatever we can through our experts. I'm not an expert, so that's the reason why I have these experts on the panel with me today. So once again, thank you for tuning in with us. We want to welcome to the show. It's going to be our first guest, and she is none other than Dr. Camueal Wright. So good morning and welcome, and thank you for accepting our invite.
Thank you so much for having me, and thank you for shedding light on what is an incredibly important topic.
Absolutely, absolutely. So we're going to get started. So tell us a little bit about you, Dr. Wright, and tell us, I guess, what kind of got you into the studies that you're doing right now. And then she's also, look, you all, she's also the vice president and chief medical officer of CareSource. So she got a lot to bring to us today. And so talk to us a little bit about that and about your role and what you do.
Thank you for those words. So, I am an OBGYN by training,
Okay.
and I practiced for many years here in Indiana. And almost 6 years ago, I made the decision to join an organization called CareSource, which is one of the managed care entities here in Indiana. And we are actually a national organization, and we offer Medicaid, Marketplace, and Medicare health plans. What's important about my role is I oversee our clinical operations and quality for our members, making sure that our members get the care that they need. And because the majority of our members are Medicaid, oftentimes they are in challenging circumstances, which may provide competing priorities for taking care of their health. So, a primary portion of my role is outreach and engagement of the community so that they can understand what is important and what steps they can take to be as healthy as possible.
Right.
As an OBGYN, I am incredibly concerned about the health of women and children. That's certainly my passion. And we know that breast cancer is the most common cancer for women in the United States. About 1 in 8 women will have breast cancer in their lifetime. And so I'm really passionate about bringing light to this, helping women understand what breast cancer is, how they can find it, what treatment may be available, and really helping be able to live their best lives.
Absolutely. As I was sharing with the panel this week, I think I've shared it with every panel that we have had this month. I'm sorry, in regards to that, in one of our jurisdictions in Tennessee, the Susan G. Komen did a research, and so come to find out, one of the locations did not have the resources, and it was a hospital there, but they did not have the OBGYN. They did not have any types of clinics that dealt with mammograms or anything like that. So once the Susan G. Komen Foundation reached out to the hospital, what they did was, and of course I'm gonna put a disclaimer on this because this is what she told me. And so she said, Diane, the hospital won't even let me in the location, won't let me in the community, won't even let me in the town. They were told that they did not have a problem with breast cancer, but the statistics was wrong. The Susan G. Komen Foundation chapter of Memphis said that, yeah, you do have a problem. There are women dying in your area. And so even though that this broadcast deals with media, it deals with PR, I just thought that I was really concerned about the women not having, you have to drive 2 hours for a mammogram for real. And I just thought that this should spread some more light, even if the women don't have the resources where they are, they can be able to get it from you all, or they can be able to go to your site and learn, or they can be able to have some digital, virtual tools, resources. And so, one thing that came to me though that helped me a little bit, it's good to communicate with more people. What helped me was one of the guests said, Tuesday, you still have to be responsible. That makes a lot of sense. We see, even if the person has it, they were saying you still have to apply some things to yourself. But and I thought,
So if I could jump in and just
go
comment
ahead.
on that,
Yeah, go ahead.
I think personal responsibility is important. But I think that there are caveats to that.
Okay.
So I think that women need to be educated and empowered to take responsibility for themselves. So
Mhm.
you can't follow a course of action that no one's ever told you about or
Okay.
that you're not aware of. So I think that that's one important factor. And then I think you really hit on something really critical, which is access and availability to care. So
Mhm.
we know that there are certain communities, particularly communities of color and rural communities, that may not have access and availability to providers, to mammograms, to educational resources to
Mhm.
really let them know. If I could just share some
Sure.
sobering statistics
That's why you're here.
with
Yes,
your
ma'am.
listeners, yes. Black women unfortunately have the highest death rate for breast cancer. So we have done tremendous work in in this country to decrease the death rate for breast cancer.
Mhm.
And it has decreased over the most recent years by about 40%. But we see that in Black communities, we don't see that same decline.
Mhm.
And this is thought to be for a few different reasons. One is that genetically, Black women are more likely to have triple negative breast cancer. So that means not having the receptors that allow some of the newer medications to work. So there's a genetic factor. But there's also that what you touched on, access and availability.
Mhm.
Um, are you going to see providers? Do you have providers in your area who are well versed and able to give you the education that you need? Do you have mammography in your area? I think there's so many different factors here that we need to tease out. So getting back to your point, personal
Mhm.
responsibility is key, and I would never say that it isn't, but I think that there's so many reasons why people may not be engaging with the healthcare system in the way that we like to see.
Absolutely. Now, like as mentioned before at the top of the question, that was just something that was brought to me. That's what one of the guests felt, that you have to take responsibility, but if the information, we're all entitled to our opinions. That's what she brought to the just I'm serious. I didn't bring that to the forefront. If I thought that way, then we wouldn't be here today. So that was her suggestion. She was thinking that women still have, even that's not an excuse, they still have the authority to take responsibility over their health. But if, as I stated, once we jump started the event with the Susan G. Komen, and she said, well, can I use your organization to be able to move into this area since the hospital won't let me in? And we did. Once we got there, those women clobbered all over the foundation for resources. It was just totally, totally sad. It really was.
Mm,
And it was mostly African American women that did not have the information that they need. We got to travel an hour just to get to the doctor, just to get a mammogram, or just to get a wellness check. That's severe. And so that's the reason why I guess my heart kind of opened up, and it continues to open up. I think this is our third year doing breast cancer awareness for women, so they can be able to have the resources. If you don't have it in your local area, you still have it um, virtual. You can be able to do something, and then you can be able to see what type of transportation you can be able to get you to wherever you need to be able to go. And so that's what we're here for, to connect and network, so individuals can be able to, I mean, because we only talk about it just in October. It's very important. People are still dying. We only just use 1 month of an entire year, and women are still pushed back, you know. And then we talked about, and I'm gonna get to you in just a second, Brynn, but people, they talk of when they come into the room, just like one of the guests had shared yesterday, that, you know, the doctors just blow them off, you know, just, you know, okay, you know, make up your mind which one you want to do. You want to do a mastectomy? Tell me what you want to do. You want to, you know, do this. And so they are frightened. They don't know what to do. And so we talked about a lot of things, you know, how the husband reacts to it once, you know, he finds out that his wife is going to lose a breast or what have you. How does he cope with it? And so there was a lot of amazing stories. There were a lot of tears too through all of these episodes. And so I don't know, we may have to come back and do this again before October. I'm serious, because women
Well,
are
thank
really,
you for
you know,
bringing light to this. I think that you're absolutely right that we need to use multiple different channels to get to women, to educate women so that they don't necessarily have to rely on the information that they get in their doctor's office.
mm,
Obviously, providers are pressed for time and they have other priorities as well. That's no excuse for not educating your patient, but that
right.
is a context that we live in. So I think that those of us in the community need to supplement that information and really provide different avenues for women to get the information that they need. And I think people like Brynn, who we'll hear from soon,
Mhm,
sharing their stories and letting women know you're not alone. There
mm,
are women going through this right now or who have been through this and
right.
are right here with you and can share what they know and what they've learned.
Right, right, absolutely. And thank you so much for that, Dr. Wright. See, I like that. Improvise. I like that. Okay, so welcome to our panel. We're going to welcome Brynn Barale, and she's also a breast cancer survivor, and she's also a health and nutritionist coach. So, and let us know anything else that you would like to share with the panel, a little bit more about you. And so, once again, thank you for accepting our invitation, for being with us today. And so, tell us a little bit about you.
Yeah, thank you for the invite. And I think one of the words that I keep hearing both of you say that resonates so much with me and my story is that empowerment. And right, that willingness to be like, all right, somebody's telling me information. What do I need to take from this to get me to where I want to be? And that's really was part of my story. So so I am like you said, I am a holistic health coach, and I'm also a 15-year breast cancer thriver.
Go ahead.
Yes.
Go right now. Go ahead.
So I found a lump in my breast, and I waited a few months until it was time for my annual GYN exam, and you told the doctor at that visit that I had found a lump. And she was like, oh, it's probably nothing, but still that discussion, that openness of sharing and knowing my body triggered a breast biopsy. And I found out 2 days after Christmas in 2006 that I had breast cancer. So the other thing about this story is I was 26 years old.
I was going to say you must have been very young when this happened.
Yeah. It was a month before my 27th birthday. So, I quickly found out, because of that biopsy that said I had breast cancer, what it meant to be a patient. Because until then, I went, maybe for my annual exam, or maybe I even skipped the annual exam. Like, I think of times when I wasn't, doing that every year.
Right.
But that initiated like the whirlwind of appointments, and having scans of every part of my body, and the lab work and the appointments, and forming this team of healthcare providers that were going to help me with a plan. So that included the surgeon and an oncologist and a genetic counselor. And that plan involved starting with surgery. I had a lumpectomy, and from that lumpectomy found out that my cancer was estrogen and progesterone positive, and I was HER2 negative. It was stage 1, so it meant it was contained to just that area, my breast, my lymph nodes were clean. And, so okay, so they say you have options, but really I felt like, kind of like you'd said, like, it's kind of like, well, this is what you need to do. And it was like, okay, well, this is what I'm going to do. Because to me, the option was you did this or you died. Right? Like that, it was like, well, there's really I'm not choosing that as an option. So I'm going to do everything I can. So I had a lumpectomy, chemo, radiation, and then I did 5 years of a clinical trial. And that the active treatment of chemo and radiation was, I don't want to say it's easy, right? But it was doable because I had guidance and someone helping me, and I had, somebody reminding me of my appointments, or when I went in for my appointment, someone to talk to and, be like, okay, this is what's going on. But it was the time after treatment that I got lost. I mean, I really got lost as to like, what do I do now? Because I was in the land of appointments and, going and doing stuff all the time. And then it was like, yay, you're done, like you ring the bell and you get all the certificates. And that was all I wanted too, was to be done.
Right.
But then I was like, like, I don't know how to just go to work and feed myself and maybe go to the gym a couple times, or like I forgot how to do that. Like, just as quickly as I was a patient, here I was back in normal life. And it was like,
but you're changed at that point, right?
Yes.
Right.
And I fell into depression, but it took me a long time to realize that was what was going on. Because like at that time I was working from home and I'd stay in my pajamas all day, and I was eating chocolate chips for breakfast, lunch, and dinner. And, I was just trying to make it through the day. And finally, one day, my husband came home from work and he was like, "You're still in your pajamas again." And it was like, oh, yeah. He's like, I think something's wrong. And I was like, I totally agree with you, but I don't know what it is.
I'm wondering if I would love to hear you talk about what it's like from a body image standpoint when you're 27 and you have breast cancer. I'm sure that was part of what was going on.
Absolutely. That was a huge part. I mean, I would look in the mirror and I didn't recognize that person at all, even if I had clothing on. So of course my breasts changed themselves, right?
Yeah.
But I didn't have any hair. I didn't have any eyebrows or eyelashes. I mean, like, it was like, I'd look at myself and it was like, who is this person?
Right.
Like, I don't remember, like, I would go out, like when I started to get like little stubble and my hair was growing out, and I'd have people compliment me on my hair. Like I had this little pixie cut, like on purpose.
Right.
And that felt good. But I was like, oh, if they only knew why my hair looked like this.
Right.
It was like, do I tell them? No, I'm just going to let them think that this is what I've done this on purpose, and it took me a while to be able to tell this story. But the reason why I do tell my story is to normalize this.
Right.
This is normal, and it is okay to not be okay.
Okay.
You know what I'm saying?
I love that. And I think that that's such a great message, not just in the space of breast cancer, but in general. If there's anything weighing on your mind, anything impacting your mental health, it's okay.
Yep.
But then also seek help, talk to someone, get out there, find a medical provider or a clergy person or just a friend. And so I think that you having this experience and giving space for that, I think is wonderful.
Yeah,
Well,
absolutely,
thank you.
absolutely. And thank you so much, Brynn, for that story. We had one guest that was on the show, I think it was last week, and where her hair started growing back, she said it just felt like pins. So I mean, so for you to have that, she said it was wherever it came back at, it was going back, it was sharp, just like pins and needles. And so everybody has a different experience. And so that is wonderful that you were able to, some people have baby hair or whatever you want to call it. And so you got this pixel, hairstyle, that no one could detect that anything was absolutely wrong. So it's just everybody has a different experience. And I'm pretty sure that was awful for the other, guest that was on the show that, I wouldn't want to touch myself and I got hair and it feels like needles. So, so this question is uh, for Dr. Wright. Talk to us a little bit about what a mastectomy is. Because, okay, so back in the day when women first heard of breast cancer or was getting breast cancer, we did not hear about these words about mastectomies. We just heard about the breast removal, this, that, and other, what it was what the care was before and after, what have you. So tell us a little bit about that, a little bit about mastectomy.
Sure. Mastectomy is one of the surgical options for breast cancer. It is not the only option, so I will start with that. Many women who have localized cancer, like Brynn, for example, can simply have a lumpectomy where they just remove the cancerous tissue and they are able to maintain their breast. A mastectomy is a larger surgery where the actual breast is removed. And depending on the type of breast cancer you have and the spread of the breast cancer, they may remove just one of the breast, or they may feel it best to remove both of the breast. Again, depending on your personal situation and the surgeon's assessment, there can be reconstruction that's done at that same time, where they have various techniques where they can create a new breast so that you can have that aesthetic appearance that you desire. Or it may be such that that's not appropriate. And so those are all nuances that have to be tailored to the individual patient and surgeon's preferences.
Okay, great. Okay, thank you. So this question is for you, Brynn. So tell us a little bit, how do you empower other women? We know that, well, I take that back. We don't know, because a lot of times women be trying to find answers as to why me? How did this happen to me? Did I eat the wrong thing, or did I exercise enough, or what have you? You being a holistic coach, tell us a little bit how you impact women in that area. We know that, I don't know if we can be able to eat the right foods. I guess we can be able to go back to Dr. Wright after you respond to that. But I know that when men have prostate cancer, of course, they give them some sort of diet like fresh fruits and vegetables, herbs, and different little things like that. At least that's what they gave to my father before he had passed. So talk to us a little bit about the well coaching that you do and you provide, and what can be able to impact women even when they have breast cancer, because that's the last thing people lose. I mean, that's the first thing sometimes some patients lose, is their taste. They lose their taste, they lose their will to exercise. Some people lose they just go into a type of hermit type of living because they don't want no one to know. And then look, I got all of these things going on with me. Don't know if I'm going to lose my husband. Don't know if he's going to understand. I think one of the guests that we had on the show, I think the child, when she went to the doctor's appointment with her mother, she took her shoe off after the doctor told her mother that, look, you have breast cancer. The daughter took the shoe off, 13 years old, and swung and hit the doctor. I'm serious. People take bad news, So we want you to talk to us a little bit how you impact women in that area.
Yeah, so if there's one message for all the women out there with breast cancer, or who have had breast cancer survivors and thrivers on the other side of things, is that this is not your fault.
Right.
And I think that is the big empowerment here, right? Is you have done nothing for this to happen. And while that can be uplifting, right? And it's something to celebrate for sure.
Right.
Also, you know, this does make life be a little bit out of control. Then you're like, okay, well, if this isn't my fault and all of this stuff has to happen, then what's going on? And I think part of what I try to empower my clients who are breast cancer survivors is to let's control what we can right now.
Mhm.
And there's three main categories that I come back to with the research that I've done, the books I've read, the documentaries I've watched, was pay attention to the things that you're eating. So what you're putting into your body, pay
Okay.
attention to the things that you're using on your body. So your health and beauty products and things like that.
Oh.
And then as well as how are you going to move your body in a way that serves you and feels fun?
Right.
And there's one word in like all three of those things, right? It's your body. And this is your body. This is your temple.
Right.
And it's like, let's control that and let's build that up and get it to this place where you're feeling good. And then, you know, like, let's do things to prevent this from happening. Again, not your fault,
Right.
but I would hope in my heart, just like I do for my own self, is like, I have this one life that I have been blessed to live.
Mhm.
And guess what? I'm going to do everything to feel good while I'm doing this. And if cancer were to ever come back into my life, that I am strong enough physically, but also mentally
That's right.
to survive this again.
That's right.
Because the treatment's harsh.
Mhm. She
So
about ready to preach.
let's
Okay.
build it up. So yeah, did you have something to say, Dr. Wright?
I just wanted to piggyback on that, and just you mentioned about having the mental fortitude to be able to deal with it again. And it's been said so many times that exercise is the most underutilized antidepressant. And you talked about feeling depressed. And I think one of the biggest benefits to eating right and exercising is that it elevates that mood. So
Mhm.
we've talked a bit about how overwhelming a breast cancer diagnosis can be and how your life is never the same. That doesn't mean that it can't be wonderful in every way possible, but you are changed through this.
Right.
But I think that there are ways that you can really help to strengthen your mood, strengthen your ability to withstand whatever the future holds. And I think proper nutrition and exercise is one of those ways. So I just wanted to piggyback on that.
Go ahead. You can piggyback anytime you get ready. That's the reason why you're on this show, okay?
Thank you.
So before we get to care
Absolutely.
source, thank you so much for that, Brynn. Before we get to care source, Dr. Wright, we want to talk about the effects of the PTSD as to how that affects women socially. Like I was explaining before, some of the women talked about, you know, their daughters, you know, and I'm pretty sure she didn't have no PTSD. She's 13, but people react to different things differently. And so people and okay, so let me share a scenario. Is what I shared on another show. So we had this mother, mental disorder. Not for sure if breast cancer was the issue that was going on, or she had overcame breast cancer, but she did something that was very fatal to her children. It was 4 of them. But PTSD was the cause of it. Not for sure what had went on previously in her life. Um, come from a very well African American family, very well upscale community background. Husband was way up there, you know, with the annual income, but she was a stay-at-home mom. So I know different things trigger off different elements of PTSD. So we want to talk about that a little bit as to, I guess, what type of resources that women can be able to have. Sometimes women Dr. Wright, they may not have a computer. So what could they do? How can they be able to connect with something local in their community to impact them so they can continue to move forward after having children or after getting that devastating news that, look, you know what, I just had, and sometimes people don't even get over it. Like, Brynn, she's getting over it. A lot of other individuals that have been on the show, yeah, hey, look, we done started our own business. We're moving forward. We're still trying to triumph over this. But there are some that do not, even if they are from a low income demographic or a high income demographic. Sometimes we don't have the support in our home. That's what I think I was hearing from the news. The husband was outside grilling for a holiday, and the wife was inside doing something to the children, and all the children are dead, all because of PTSD.
So thank you for that question. So for the listeners, PTSD is post-traumatic stress disorder. And I feel like that comes under a much broader category, which is
Okay.
trauma.
Okay.
And what we're learning in medicine is that trauma, past trauma, has a huge impact on how we process information and how we behave moving forward. So when you give someone any sort of bad news, such as a diagnosis of breast cancer, it's coming, it's not coming in a vacuum. It's coming into the environment that's already there mentally for that woman. So if she has already had traumatic experiences in her life, or she witnessed trauma, maybe her mother was abused, maybe her children were abused, maybe she was in an environment that was violent in the community, et cetera. All of that factors into how she then responds to that bad information.
Okay.
So if you have trauma, or if you are dealing with some mental health condition to begin with, you are more likely to manifest certain behaviors on the other side of that diagnosis. And so while not knowing the full story that you're sharing, there probably were many factors that contributed to why that individual behaved in that manner. What I would say is anytime anyone deals with anything traumatic, that may be a medical diagnosis, that may be a death, that may be loss of a house or a job or a spouse or whatever, we need to have multiple avenues for that individual to seek care. So that goes back to what we talked about at the top of the hour, access and availability to medical care. So we need to make sure as a community that we're doing everything we can to have health services be available for individuals. But your care doesn't necessarily have to be in a doctor's office. You can seek support groups. So I know many people find value in support groups and just talking to someone who has a shared experience. So communities will have support groups, churches will have support groups, medical facilities will have support groups online. So you mentioned people not having access to computers, and that is a factor. But if you do have access to the internet, there are many online forums where you can find care and support. And then sometimes there are people in your life who, if you feel comfortable opening up to them, they may have a shared experience, or they may know somebody that they can connect you to. So I think that we need to have multiple avenues for people to get the care that they need. We also need to normalize having stress and feeling bad about things. And I think Brynn said this very nicely. We need to make it okay for someone to say, I'm not okay.
Right.
We need to make it okay for people to seek mental health services if they feel like it's necessary. We need to make it okay for people to be on medication should they and their doctor or their provider feel that that's appropriate for them. We need to create a safe space for people to take care of themselves from a mental health standpoint so that it does not escalate to the story that you shared.
Absolutely, absolutely. And as I stated, they were from a very good, background, income, and what have you. It's just, as you stated, something else could have been going on before, this was happening. I think the news report was like it was some issues that were going on before with the PTSD, but sometimes it's kind of hard for someone to check their spouse into a sanitarium. It may be difficult for that person to do that, especially if you have 4 children and you may not know who's going to care for them and what have you. And so sometimes I guess some spouses may just, go along with the process and figure that it's going to probably weigh itself out later on. But in this incident, it didn't. And it,
And that's why it's important to have these conversations, because it's not just for the person going through
okay.
the traumatic situation, but it's also for their village, right? Their
Yeah.
family and friends. So I think that we also need to have discussions about what to do if if one of your loved ones has breast cancer, how you properly support them, how you properly recognize signs of depression, and how you get help. I think that there are lots of things that you can do prior to having that person committed in any way. And the simplest thing is just opening up a dialogue.
Yeah.
I noticed that this is difficult. Are there things that you want to talk about? Are there struggles that you're having? How can I help? That is the simplest question that you can ask anybody in any situation.
Yeah.
How can I help? And let them drive that conversation.
Absolutely. Absolutely. Um, And thank you so much for that, Dr. Wright. So this question,
Thank you.
still with the PTSD, Brynn. So how do you help women to be able to, I know that you do holistic coaching, but I'm pretty sure food is some of it. And of course, mental support is some of it too. So how would you, kind of help an individual in your case with your organization that you have to be able to help individuals to live healthy, eat right, be nutritionists and what have you. So how would you help an individual that's suffering through this? Because like Dr. Wright said, the information, the resources that we need, and this is a big metropolitan area. This family lived in an upscale area. It was not like it was a poverty zip code. But I guess it was to the fact I don't know if the husband perhaps maybe have overlooked it, and so then now the wife is on the news, and then the children are gone, and so he's left alone by himself. And so just like Dr. Wright was stating before about the village, I don't understand how sometimes we can't just come together. And I know it may be something, well, how will we know a problem if there's a problem? I'm pretty sure someone else had to have seen that problem on this mother before this incident even happened. Oh, come on, I'm not judging. Go ahead, Brynn. Someone else had to have seen that.
Yeah, so I love this topic, by the way, because again, this is the awareness and normalizing it. And
Mhm.
I had someone over the summer even tell me with PTSD, the D is the disorder, right?
Right.
To let's even drop that off of it. And it's
Okay.
just right? Because we all have trauma,
Right.
whether it's from being in a car
Yeah.
accident
Yeah.
or being a diagnosis with our health or childhood abuse or spousal abuse. There's a lot of things, right? We all have a little bit in us.
Right.
And the disorder makes it, even that word just makes it be like, oh, well, I don't have that, right? Like we do. So this is it. So thank you for this discussion. And yeah, and part of that change, it's like a mindset change
Okay.
of surviving to thriving after breast cancer,
Okay.
right?
Right.
Surviving makes you, it's like a victim mentality, like, oh, this happened to me, to moving to this thriving and being like, well, yeah, I'm on the other side of this.
Mhm.
I'm not broken.
Mhm.
I don't need to have any guilt around this.
Okay.
And that I didn't do anything to cause this cancer to happen.
Right.
And life is good. And there is that shift. And everybody has their own journey through that area.
Mhm.
But I feel like one thing that I hear from my clients over and over again, which it's really eye-opening to hear, but it's like, all right, this is what we need to grab a hold of, is that they're waiting for the next bad thing to happen.
Wow.
They're just sitting around waiting for the next bad thing to happen. And I'm like, all right, we can't sit there. We gotta get out of there. And it's like, how are we gonna get there? Like, because it's like, just because you had cancer, you are no less of a woman. Just because you had breast cancer, you are no less of a mom, a sister, whatever, right? Like, there's good life on the other side of this. And it's like, but I get it, because I was there too.
Okay.
Right? I was there in that land, like, I don't know what to do. And it didn't happen overnight. It took time and exploration, but it's like being and knowing, you know, as I met other women who were on the other side of things, and I was like, oh, okay, I need to get there, right? And it was that process of eating differently and continuing to move my body. Like Dr. Wright says, yes, it's beneficial, right? But the why behind it is really because it's helping change the chemicals in your body that are making you feel good. Right. And that's where the magic is. And, you know, we don't need to go into a science lesson, but really the reason why these things matter is because we are composed of this very intricate system in our body. And it is changed by some of the things that we do to our body every day. And those are the things we have control over. And that is a good place to be, to get on the other side of that pit, that sense of feeling lost.
Okay, wonderful. Okay, so Tuesday we had Turning Point Rehabilitation Center. So we talked about they had 3 of their supporters, doctors, advocates on the panel on Tuesday. And so we wanted to share a little bit about different institutes, and I tried to get the information, the difference between, and it was a total big difference between them and the Cancer Centers of America, what have you. So this one allows you to come in. You don't have to do anything. You can go in and sit down and have a cup of coffee, read your book. It's a place from you know, if you don't want to be at home, you can go in and you can be in groups. If you don't want to sit in the group and talk, you can be able to, you know, do whatever you want to do. You can, you know, hang out. You can be able to get on your laptop. It's like a little Starbucks type of away from home type of facility where women can be able to be encouraged, empowered, but they can also be themselves. If they don't want to be bothered, they don't have to be bothered. They can be able to walk up to this facility, this rehabilitation center, and they can just let it all hang out according to how they want to. And so I thought that was so very intriguing to be able to understand and hear that. And so that's the reason why we're going to get some more information. I know you talked about your role with CareSource, but we want to learn a little bit more, much more about CareSource as to how women can be able to even be more impacted even the more. Because like I stated before, sometimes you can go into an institute, a woman will pass out. She already been devastated. She got the news, and then here she got these white coats, white jackets, standing up, you know, looking at her, go left, go right, follow the blue blocks down the hallway or what have you. They're already frightened. And so I thought whatever Turning Point was offering was a wonderful thing. And women need to be able to understand that they are loved. As what Brynn stated, this is not their fault. This is just something that came up. This is not, they don't have anything about no statistic, their birth date. They came after baby boom back in the 60s. This don't have nothing to do with this. So women need to know that they are loved. They're supported without being judged, you know, or they're just another number. Get on out the way, get on down the hallway or what have you. And so I thought that was a wonderful thing that Turning Point offered. And so that's the reason why we want to learn a little bit more about CareSource as to how women can be able to come in, sit down, and be themselves if that's something that you all offer on your platform.
Thank you so much. So as a managed care entity, we offer insurance plans. So we wouldn't necessarily have women coming in and sitting down.
Okay.
But what I do think that we offer that's really critical to this is care management. So for women who wish to elect for this, we have case managers, which will come alongside of our members and help them navigate the healthcare system. So like we've talked about, things can be incredibly overwhelming. So you get a diagnosis, now you need a specialist, now you need tests, maybe you need surgery, maybe you need some medical equipment post-surgery. So our care managers, our case managers will help a woman work through all of that. We'll help her find the proper specialist. We'll help her get any authorizations that she needs for the surgery. We'll help make sure that she has her medication. If she ends up having chemotherapy, for example, we'll help her get that. If she ends up going on one of the medications that help decrease your chances for recurrence, they can help with that. I think what's incredibly important is that they will also help with her behavioral health needs.
Right.
So if she's starting to feel down, if she's starting to cope with depression or anxiety, we can get you plugged in with behavioral health providers who can help with that, whether that be therapists, whether it's psychiatrists, whether it's social workers, whatever you need, we can help connect her with those people who can get her help. As well, we have telemedicine programs. So sometimes we talked about body image. So maybe she doesn't want to go out. Maybe she doesn't want to be in a doctor's office. Maybe she's not feeling well enough. We can connect her with care that she can get in the safety of her own home, where she can begin to work through those things. We also are building out our peer support services. So we talked again about having that shared experience, having that lived experience. So we are adding people to our team who can talk to our members from a place that they've been. So not just go here, do this,
Right.
but here's my experience and here's what I found to be helpful.
Okay.
The other thing I think is that we like to see ourselves as a convener. So we work very often with community-based organizations in our areas. So we can't do it all. No organization can do it all. And we know that there are wonderful organizations and advocates in the community already working to serve women who have breast cancer. And so what we're doing is we're identifying those community partners and we're bringing them into the fold. So when we interact with a member, we can say, hey, maybe you connect with such and such organization or this entity because they do great work.
Okay.
So I think that we do so much more than just pay claims. We really want to meet our members where they are and help them have the most fulfilling lives possible. So that is really assessing their needs and connecting them to that entity that can really help them get to the next level.
Absolutely. Basically like a resource linkage. You provide
Yes,
resources.
exactly.
Absolutely. That is powerful. Now I like that. I was on a board back here several years ago where they connect with different churches, different organizations, different other businesses, and they brought all the resources together so a person couldn't say, well, I didn't know that a grant was available. Yes, you do now because you have a resource here and we're providing the resource in connection. So I like that. That's wonderful. So thank you so much for that, Dr. Wright. So that's
one thing I would add as well is we have a whole division of our company called Life Services, and it is dedicated to what we call social determinants of health. So those are those social needs that impact our medical needs and our health. So what we know is that if you are struggling with housing or food insecurity or unemployment or transportation, as we talked about, that can really impact your engagement with healthcare and your ultimate outcome. So we have a whole team of people who help our members bust through those social barriers. And for members who are interested, they can connected with a life coach completely free of charge. And that life coach will work with them to understand, where do you want to see yourself? Where do you want to go? What are your employment or your education or your ultimate goals? And what's hindering you from those goals? And how can we help as an organization? Or what other community-based organizations do we know of that can help you, so that we can really help develop a roadmap for that individual? So for women with breast cancer, they have goals, they have dreams, they have things that they want. This is a bump in the road. Let's figure out how we help you overcome that so you can ultimately reach those goals. So that's another thing that I would want to highlight about CareSource.
Yeah, absolutely. That is wonderful. That's wonderful. So that's going to be the same question for you, Brynn, with your organization and brand that you offer for women. What are some of do you have group sessions that you impact the women within the community with breast cancer, whether it's healthy nutrition, whether it's let's do a 5K walk or 2K walk or what have you? What are some of the things that you offer with your brand and products for the public or the community?
Yeah, that is great. And I agree. And I feel like that sense of community and coming together helps bring the awareness factor of normalizing this, right? Of normalizing life after breast cancer and during treatment, and how that process can continue moving along. Because like Dr. Wright says, yeah, life is gonna go on. This is just that bump in the road. And sometimes it's that bump in the road and it wakes us up and we're like, hey man, let's go do big things, right? So
Right.
that's it. So yeah, part of my service is I love to do like educational talks in the community. I'm very food focused. So it talking about, how to implement different foods into your diet, but also the reason why, right? Like it's not just, oh, we need to eat this, but it's like, what is it doing in the background? Like, why is this important?
Okay.
But also I implement, I do some online retreats too that are completely free of cost. Sometimes I do them geared to young adult cancer survivors, and then sometimes I do them for breast cancer survivors specifically, because we do, young adult cancer survivors have their own needs, and so do breast cancer survivors. And I was in both of those categories.
Okay.
Right. But now that I'm in my 40s, the young adult cancer group, they don't want me anymore, which is not a bad thing. I'm like, yes, I'm not in
Wow.
So I have adapted things to be that community source for breast cancer survivors,
Right.
to have the time to tune in and listen and learn to love and trust our bodies again, and offering that safe place in a community to do that. So those are the big things that I do for the breast cancer survivor community itself.
Okay.
So that's it. It's about bringing people together, like Dr. Wright said, because man, when we start doing that, things fall into place a lot easier than
Right.
us just sitting there on the struggle bus by ourselves.
Right. Trying to figure it out. Absolutely.
Mhm.
So now
Absolutely.
we've reached we've reached the segment with the final word. And so this is going to be a two-pronged question. And so the first one is share with the audience what you would like to leave with them, for the women or for the men too. We did a live event with the Susan G. Komen Foundation, I don't know, 2014. And so it was men that showed up too. So I was shocked. I'm like, okay. So for whatever you would like to leave for men and women, do that. And then on the second prong of the question is to be able to share with the audience as to how they can be able to find you, how they can be able to find you through any social media links that you would like to share, your website, and you can be able to share any publications, any books that you have published, or any type of blogs that would be helpful. And even if the book is not really actually geared towards breast cancer, long as it's geared towards something where it's inspiring for women, you can be able to do that this time. And we're going to start with Dr. Wright.
Thank you for that. I think that I really love the way Brynn and I have left it already, which is breast cancer is a bump in the road. So what we know is that the overall survival rate for breast cancer right now, all comers, is over 90%. And it's even higher if it's caught early. So the majority of women will survive breast cancer. And I think that that's an important message. And I want to leave people with a sense of hope. We have to deal with this, and there are ways to treat this, but then there's something on the other side. So let's not lose hope, and let's not lose what's on the horizon. You can still do really big things, and you have a testimony. Once you've gone through something, you have a testimony that might be able to help other people. As far as where to find us, caresource.com. That's the easiest way to find us. You will find everything you need to know about the organization. There are ways to contact us if you want to become a member. If you're interested in the various markets that we're in, you will find that information. If you want to reach out to me, I can be found on LinkedIn. So just look me up. My first name is spelled Camual. Last name is Wright, Wright. Thank you for the opportunity to be here today.
Absolutely. You are so welcome. Brynn?
So yeah, I love that too, ending on the high notes, because that is what this is all about, right? And hope we have shown the truth, but also shown the bright spots on the other side of breast cancer. And so, so I empower breast cancer survivors to live an amazing life after cancer. And you can find me at coachbrynb.com, and you spell Brynn, Brynn. So that's coachbrynb.com. I'm also on social media, and you can find me the same way. But I feel like I've really appreciated this time with you both today, and thank you. It's good to again have that community and know that there are other worker bees out there on the same cause, doing the same thing, and it really makes my heart so happy. So thank you.
Absolutely. And thank you all for taking the opportunity out on today to be the guest. We have learned a lot in this last 4 weeks, and we have shared so much with the community, with the audience, with the public sector in regards to that. And so we just wish you both the best. I mean, just keep doing what you're doing so women can continue to learn more about this. There are so many that are trapped, though, and that's the purpose of us having this all month long, so someone can be able to pick the video up, whether it's on Roku, you can pick it up in somewhere else, tune in, you can pick it up somewhere. Okay, there's somebody talking about breast cancer. And so women can be able to relate, connect with one another, connect with those that are on the show. And so that's our main objective, is making sure that women network with one another after the show. So that's the reason why we allow you to be able to share your books or your links and what have you. So thank you so much once again for being with us. This concludes our 4-week episode of breast cancer. So hopefully someone have learned something. They can be able to take it back with them and also connect with the professionals so you can be able to get a handle on what it is that you can be able to achieve. Breast cancer is not death. All sickness is not unto death. That's what the scripture says. So we thank you so much again. And so everyone have a wonderful day.